Today's Wheelie Good Tip is brought to you by Coloplast. Thanks guys for your support.
Here today talking to Nicola from Coloplast about a really important topic for people's spinal injuries is bladder management. I think it's proven to be one of the key concerns that most people have is having that reliability and predictability about bladder control and how to manage it, in particular catheters. And so Nicola, what have you got here for us today?
Great. Thank you very much, Andrew. Always great to share a coffee with you and talk about catheters. There is quite a variety of catheters on the market that people can pick and choose. When we're doing intermittent catheterisation, emptying our bladder, there are a great range of hydrophilic catheters available. So you're obviously familiar with hydrophilic, are you?
That's the sort I use. Yeah.
This is the one that you use, yes. A lot of people will be quite familiar with this catheter. So when we're talking about a hydrophilic coating, it's a coating that is bonded onto the catheter. So it is lovely and smooth and lubricious when you're inserting the catheter, and more importantly when you're pulling it out. So you can feel that smoothness there. So that helps to minimise any micro-traumas that can be created as you're inserting it into the urethra. And micro-traumas can be a risk factor for UTI. So it's really important that using a hydrophilic catheter we are really protecting that urethral lining. So that is quite a common catheter that people use. But there are a lot of other catheters that have now come onto the market, and it's really around about tailoring catheters that actually work with your lifestyle, things you want to do with socialising, going out. So there are a lot of varieties now available. There's ones that are a lot smaller, which are more discreet. So here we have a compact catheter which is designed for the females, and we have a male compact catheter. So this is a great option for when you want to go out and about and you don't want to be carrying a lot of long catheters with you. So this one, concertina's out.
So that's hydrophilic as well?
That is hydrophilic. So all these catheters I show you will be hydrophilic. So when you're finished, you've inserted that catheter and drained your bladder, you can actually just push this straight back into the container and close it up. So that makes it a really discreet option for people. Then they can just carry it around in their pocket and throw it into the rubbish bin at a later time.
So when I first started using catheters, I had a non-hydrophilic one. And after about 5 years, it just stopped working. I couldn't pass it. So I think it's important to realise that just because you're stuck with one regime, you can change.
Yes, you can. You certainly can. And people now are changing the way they're catheterising. They might do a type of catheter, say, at home in their own environment, but then when they're out and about, they might want a different style of catheter.
Yeah, because a long thin catheter like that doesn't fit very well.
Yeah, it's really hard to carry it around. So there are catheters that we have that have a bag attached. So when you're out and about, you can get a catheter that's what we call a complete set. So this is a catheter that has a litre bag attached to it, and you just open this up. So if you're out and you don't have to carry a container under your chair.
Well, it's really useful on aeroplanes.
Very useful on aeroplanes and in public toilets and that, and you're not having to carry that container to pop, to drain your urine into it if you can't get up close enough to the toilet, or you're not wanting to transfer it across into the toilet. So these are very simple to use. You just snap this piece here, and that allows for the liquid that's already in this catheter to drain through. So this is a little bit different from the standard catheter. So you're working a little bit close to what I call the business end. So you're not having to hold a catheter out at a distance. For some people that can be quite a challenge, especially if they've got a little bit of a tremor in their hand trying to get the catheter inserted. So this, you can hold the catheter on the sleeve. This is a dry sleeve, and you can hold it and you can actually direct the catheter in and then move it
So you
move
can
it
have
through.
quite grubby hands and still get it done.
Yeah, very good for hygienic. So again, it's minimising that risk factor that comes when you're catheterising. So when you're having to lubricate a catheter and then try and insert it, you add more risk to developing a UTI as opposed to something like this with a sleeve. So this is great for people who just want to hand sanitise, or they're working and they're in portaloos or areas like that. So once you have emptied your bladder, you can put the lid back on it so it's all nice and sealed. This is also great for people who want to catheterise in bed at night. So instead of getting up and moving to the toilet, they can actually just sit up and they can do it in bed. Once they've closed that off, it's all nicely sealed, and they can just pop it down into a bucket.
Tidy it up in the morning.
Tied up in the morning. Some of our walkers really like this too, because they take a little bit of time sort of getting themselves mobile and getting themselves moving in the morning. So when that happens, they can actually do a catheterisation just close to the bed or close to where they're getting up. So that's really ideal for getting people out and about, because we want people catheterising regularly throughout the day when they're away at work or socialising. There's also been some changes in technology, and there's a new catheter that's come on the market with what we call multi-hole zone technology. So instead of a 2-eyelet catheter, it has 80 plus holes in it. And this catheter comes in a male version, very similar to this, and it also comes in a female size. So this is the new compact catheter for women.
What's the point of having so many holes? What's that about?
Very good question. What this does is, I'll just open this one up here. When you insert this catheter, you can actually see all the little holes there. Generally, when you're inserting a 2-eyelet catheter, you need to drain as much urine out of the bladder as possible, because that becomes a UTI risk if you're leaving residual urine sitting in the bladder. So what this technology is designed to do, this one in the female's got 50 plus holes. When you insert it and the urine starts to flow, you don't have to reposition it. It will drain the bladder right down.
Yeah,
completely.
with the 2-eyelet, sometimes the wall of the bladder will suck on to block one hole.
That's
Block
right,
the
that's
holes.
right.
Yeah.
And people think they've actually emptied their bladder, so then they'll withdraw the catheter. And we're always taught to slowly withdraw it and try and get as much urine out. But then we're always told to floss our teeth, but sometimes we don't. So, so this is a new technique for people. They don't have to reposition it. It also flows nearly 50% faster than a 2-eyelet catheter. And also they don't have to do that repositioning.
I mean, that's how long has that been out?
This has just come out last year.
Yeah,
so
if you're stuck in your old ways, 20 years, you don't ask the question, you don't find out what's new.
No, you don't. You don't. And what you're discharged on may be not what's suitable for you to use, a few years down the track. And these catheters have been designed to get you out and about and socialising and spending time with friends and family away from your home base. So around about 30% of people don't like to catheterise away from their home base. So these products are designed to make people feel more comfortable and confident doing that.
Nicola, they've got all sorts of bits and pieces here, so there are clearly a lot of options.
There's certainly a lot on the market that people can pick and choose. And I think the best thing to do is tailor the products that suit your lifestyle. And the best way to do that is actually to try the products. So you can get free samples to try them out. And also, if you want to do that, you can also contact your health provider and get some information on how you can get samples to try the different catheter options. And that's something I really encourage people to do, because the proof's in the pudding, so to speak, and until you actually try it, you're not quite sure how this is going to work best for you. So we really encourage to try.
Great, thank you, Nick.
You're welcome.